course, this hour, there's a number of things we want to address. You know, Daktari already talked about the statistics. That was one of the issues we wanted to address. And he said that close to 40% of men may have an issue with infertility that needs to be checked. Close to 40%.
And I think that was in the African continent.
That was in the African context.
But
yes. Now we will also talk about like what remedies are available there for people who have problems, and maybe messaging, like maybe what media needs to do in order to message this correctly for men to understand, like the adversity of this. But to get us back on Daktari, like we're talking about right before the break, is infertility a random occurrence? Is it genetic? Or are there other lifestyle issues or habits that may lead to infertility? Or is it a combination of all the three?
It can be a combination of all of them.
Okay.
If I can start by the possible causes of infertility. Remember we talked about the ejaculate having issues.
Yes.
So you may have issues with the numbers of the sperm in an ejaculate. You may have issues with the motility of the sperm. You may have an issue with the morphology, that is the number of normal forms. So that already is a problem. What can lead to this can also be quite a number of issues. For example, some of the medications that we use, medications, for example, for high blood pressure, medications for diabetes, can actually have an effect on, first of all, in the function itself. That is the function of intercourse, and also may have a secondary effect on the quality of the sperms that we get.
Okay.
May have an issue. We talked about the tubes where the sperm pass through. There can be a blockage. So if there is a blockage, the sperm will not come out. And you may have an issue with the undescended testicles. Remember we talked about that young man, that the parents should make it a habit when they're washing him to actually check and see whether the testicles are where they're supposed to be.
Yeah. And is that a random occurrence, or is it genetic, or is it just...
No, that is random. That is
okay.
basically random.
Okay.
Genetic actually is a small percentage. And as I said, remember I talked about mucoviscidosis, which happens in certain communities, especially when they get married to each other. So they pass on this hereditary problem. And very, very prevalent amongst the Jewish community.
The Jewish community.
Yes.
Because of marrying from within.
Because of intermarriage.
Yeah.
A small problem, what you call not really fragile, where you have the Y chromosome, where a small fraction of that chromosome is actually what you call a microdeletion. But that one also is very rare, and it's also a genetic problem. But that one can be sorted out later on. Now, we come back to the issue of the testicles again. You may have the testicles which are twisted. It can be twisted, what you call torsion of the testicle, can be one or on both sides. And if that blood supply is actually sort of depleted, the testicles will die.
Do you mean twisted as in it was already twisted from birth, or twisted through an accident? Or twisted
in, when you in adulthood, for example.
Okay.
It usually happens when in adulthood. Rarely does it happen in childhood. And that can be because of different reasons. You talked about an accident, injury. We talked, gentlemen tunapenda rugby, we like football sometimes.
Contact sports,
karate, and so on.
Yeah.
Sometimes when the guys are standing in front of the goal.
Or free kick.
Yeah, a free kick, and that ball hits, those hands which have been...
The jewels.
And then you can see the guy rolling on the ground, and you can actually feel the pain on his behalf.
Right.
So that cricket as well. Hockey sometimes, and so on. So that can also, injuries basically to the groin. You may have diseases as well, infectious diseases, viral diseases. Remember when you're growing up and your friend has swollen, the jaw is swollen, mumps. Mumps in childhood is okay, but when it is for you get it in adulthood, it spoils everything. So there'll be no production of sperm at all. So we have to be careful. That is why when you see a young man having, in childhood, you actually, and you are encouraged to take your child there so that he can also be infected. And then he has a lifelong, protection.
Immunity.
Protection.
Yeah. Okay.
Yeah. But if you're not infected and you're not vaccinated and you do get, contact with mumps in adulthood, unfortunately, it will lead to what you call otitis, mumps otitis, infection of the testicles, and that can actually ruin completely your chances of getting pregnant. Of fertility. Other infections as well. Gonorrhea. We don't talk about gonorrhea these days. We don't talk about syphilis. They also are a source of infection and a cause of infertility. We actually don't even talk about chlamydia. Talking about infertility, chlamydia. Chlamydia is a silent killer in the sense that it does not have any symptoms at all. And again, it's an STI, sexually transmitted infection. And it will affect the tubes of the lady. It will also affect the tubes of the gentleman as well.
Okay.
Now, we'll go into other issues. Accidents, for example. If you have an accident, and your spinal cord is injured, obviously there won't be a chance of you having an erection and having an ejaculate. Tumors, different tumors in different places. Talk about medications, for example. Talk about chemotherapy, radiotherapy as well. Some professions as well. What professions are we talking about here? Guys who are truck drivers, long distance truck drivers. So they are seated 8 hours, 10 hours, 14 hours.
Yes.
Even if there is a break in between, but they are seated, and that engine produces heat, and that heat can actually get to the jewels, as you said, and it can have an effect on the quality of the sperm. People who work in places where there are high temperatures, in bakeries, for example, in foundry works where they produce glass and so on, that heat can also have an effect.
Okay.
I think somebody asked about the laptop. It has actually been proven that when you take that laptop and put it on your laps and you walk away, that heat from the fan actually, remember in the scrotum, the temperature is slightly lower than in the general body by about 1 degree. So if you increase that to the temperature of the normal body, or even it's slightly higher, then obviously
Unawa soldiers.
Okay, so if you're using laptops, you want to place them on a table or place them on a surface?
Absolutely.
Okay.
Where there is no contact.
Okay. Now there's also other lifestyle issues that people have been asking about. Smoking, alcohol.
Very good.
Bangi.
Very good.
Miraa.
Very good. Very good. Now, I have seen, the other day I read in the newspaper that Germany wants to actually legalize marijuana. In the Netherlands.
Maryland. We are voting on it on the ballot on November 8th. Yeah. In fact, maybe this might influence some opinions depending on what you're going to say.
Okay.
Edibles.
Let's start with edibles.
By the way, kuna story ya edibles tulipewa. Kuna mtu alikuwa naona what do you call that guy, the agent of
Malakul Maut.
Malakul Maut.
Yes.
Alikuwa namuona. I'm not pointing and identifying who it is. All I'm saying is kuna mtu aliona Malakul Maut. But carry on, sir. Carry on.
Now, if we start with the cigarette smoke. Cigarette smoke has about 2,000 to 3,000 chemicals. 2,000 to 3,000 chemicals. And some of those chemicals are actually go and displace the elements that are needed in the production of sperm or even in the motility of the sperm. For example, zinc is replaced by something else. So the sperm actually don't swim the way they're supposed to swim. Zinc is very, very important in the mechanism of swimming of the sperm. So if you're a heavy smoker, that is going to be a huge, huge challenge to your fertility. Apart from that, some chemicals like selenium, they push away selenium from the system, and the quality of the sperm is poor, and so on and so forth. Bang is even worse. Marijuana, weed is even worse. apart from it affecting your brain, it will affect drastically the quality of the sperm that we see. Talk about lifestyle issues, whether you're smoking, of course, the foods that we eat. Diet is very, very important. We have, I think in the US, I think it could probably even be worse. We have reached a place whereby we are less mobile, we walk less, we do less exercise, and we travel more by vehicle.
Uber.
Yeah. So like in the US, you have very long, distances from where you live to the store or the supermarkets. So what do you do? Hop in a car. When you're going to work, hop in a car. So you actually don't have that time to burn that energy, as it were.
Some people even to the mailbox.
Even to the mailbox,
they'll drive.
So that becomes a challenge. With the time we accumulate this fat, most of the time, the gentlemen, we have a public opinion, quote unquote.
I don't know why he's looking at me, but in his heart.
And the ladies also. So when it comes now to bedroom issues, it becomes a challenge. So if you have a public opinion, and we like our women who are well endowed, so sometimes it becomes a challenge. Mzee afiki mali anatakiwa kufika. So, and even the intercourse itself becomes a challenge. It becomes a job which you don't want to do because it's difficult, number one. You are challenged, physically and so on. So that contributes to actually infertility, in a secondary way. Talk about drinking. It is not the drinking per se, but it is what comes after the drinking. In some places, they say you drink 1 bottle, 2 bottles of beer, it's not a problem. But when you drink 3, 4, 5, X number of bottles of beer or shots of spirits, the inebriation that comes with it makes you not make right decisions. That is number one.
Yeah.
You end up in bed with some people in the morning. Nashindwa huyu alitoka wapi, and you don't know what has happened. And you don't know, and that is, by the way, it works both ways, for the gentlemen and for the ladies.
Yeah.
The ladies is actually even worse these days, because what has come out is that what the men can do,
women can do better.
We can do better.
Yeah.
So that was the motto of my high school.
It's the motto of your high school. I had a patient who came to see me, a lady, and as we were talking, one of the questions actually I asked is, do you smoke? She said no. Do you drink? She said yes. I said, okay, what do you drink? She said, I drink a bottle. I said, well, I was thinking it's about a bottle of wine, which in itself is a lot, by the way. Okay. So I asked, a bottle of what? And she says, a bottle of Johnny Walker.
What?
Mzinga. And then I ask,
I'm with Dr. over here.
Mzinga. So you drink 1 bottle of Johnny Walker? I said yes. I said, over what period? He said, on Saturday night. So I go out, I drink a bottle of Johnny Walker. Is it 1 liter or 7? I don't know. Whatever it is, it is a lot. So, when you drink such a huge amount of alcohol, number one, it's a problem to the body to actually, digest it, And then apart from that, the effects are horrible.
Yeah.
So
the liver.
It's the liver. And then obviously the decisions again, the decisions we talked about.
Yeah.
So I told her, you have to really prioritize what you want. If you want to have a baby, you have to stop drinking 1 bottle of Johnny Walker on Saturday. She never came back.
Well.
So there we go. and so on and so forth. So it's a huge array of things that we have started doing, or things that are happening that we do, which will have a direct effect.
And you haven't talked about Miraa. There was also Miraa.
Miraa, yes.
Before you address Miraa, I had my name being called out.
No.
So let me address that.
Uh-huh.
I'm in agreement with Daktari. A bottle
of Johnny Walker
in 1 night.
Yeah.
That is mother than you.
I know, that's too much.
No.
Yeah.
Even me, I'll tell you.
Yeah.
By the way, okay, hold on.
Oh, you can.
But I know.
Yeah.
No. And I'm telling you. And you see, he's talking about 1 liter.
Yeah.
In 1 night.
That's too much.
Kuna watu, there are some people who are 4-cylinder. V6,
Yeah.
V8, kuna V12. Some people out there are like a Boeing 747.
Okay.
Consumption,
Yeah.
aina ngori.
Lakini 1 liter is still a lot
That's a
per
lot.
night.
But in context, if you haven't, it is a lot. And I'll tell you from Kenya, it is a lot.
Yeah.
It is a lot. Because if you can do that, you can down one. You know, like if you have a 1 liter and you're amongst friends, that's different. But if you're solo, 1 liter.
And you down it, there's a problem.
Maybe
There's a problem.
Maybe the friends are also downing 1 liter as well.
Maybe, but we're talking about this one.
Oh, this one, you're saying if friends are sharing.
If friends are sharing,
Okay.
that one liter over there and is our. But
Furaha kulewa na marafiki.
iyo sasa.
I
1.1
actually,
liter.
You know what I think? I
Yes.
think she lied to you.
No.
Let me say this.
Yes.
I think she said she only pinned it on Saturday night because I don't think you can drink that much and not drink any other day.
Let me tell you.
That
You'll
is-
be very surprised.
You'll
No.
be surprised.
You'll be very surprised. Yes.
So you can just dedicate
Yeah. Let me. No.
Saturday.
You can say Sato.
Yeah.
Mtachafua. Wacha nikwambie.
Alafu na detox wiki mzima.
Yes. It is a possibility.
Wow.
Okay. All right.
We're
Miraa.
not saying that it won't happen. It has never happened, but we also cannot say
It is not a possibility.
exactly.
And then
Okay.
the other
Yeah.
thing, why would she actually say, I drink?
'Cause
Why
that's
would
a
she lie
lot.
to
I'm
me?
like,
Why would she lie to me?
I'm thinking maybe she did it over the weekend. You know?
In one sitting, even me sometimes I'll say because I was called out.
Yeah.
If I have like a 750,
Yeah. You finished. by yourself.
nafika nani inaanza is creeping 3/4 empty.
Yeah.
I'm like, oh, hold on, wait a minute.
Yeah.
Washeke just said, as you read, many Kenyans are functioning alcoholics and don't even acknowledge it.
There you go.
100%.
True.
All right. Yeah, that's
Yes.
for another show
Yes.
altogether.
1.75
but let's-
iliangushwa, but not by me.
Yeah,
but by me. But I won't
let's
say
get
anything.
back to Miraa,
Miraa.
Mogoka,
Yeah.
Kangeta,
Yes.
Giza.
Hizo giza sijui ni gani.
So what is that? How do you know these things?
Wacha mse wa edibles atuambie. Umse wa edibles.
No people.
Umse wa edibles. I mean, he gave a story about edibles. Watuambie. Kangeta.
Kuna Kangeta. Kangeta is actually a part of Meru. That's where that Miraa comes from. It's called Kangeta. Ni miti refu hizo hapo. Alafu kuna Giza. Giza ni fupi. Wani kama maini.
You see darkness.
Hiyo hapo kila. Yani
You see
hiyo
darkness.
hapo. Hiyo haiwachi dent mdomoni. Alafu saa kuna ile ya
What does that
hustlers.
even mean?
Yeah.
Kuna ile ya hustlers. People on the ground. Mogoka. Yeah.
Mogox.
Now,
Yeah.
with Miraa, Mogoka, umesema Kangeta na
Giza. Na Asli.
Giza. Na
Asli pia.
Asli.
Ziko nyingi.
Number one,
Jesu.
the mechanism of addiction is the same because they are addictive.
Yes.
I had a couple who came to see me, and the wife was absolutely distressed. Anasema mume wangu ikifika Friday anapotea
Yes.
mpaka Monday,
Super addictive.
na anaenda kumtafuta huyu yuko wapi. So it's an addiction, and that addiction pulls you away from what you're supposed to do. That is
Yes.
number one.
Absolutely.
We don't have a very clear biochemical mechanism how it affects fertility directly.
Okay.
But the fact that you are not where you're supposed to be doing what you're supposed to do
Yeah.
in order to have that family, that can be a mechanism of infertility itself. Ukienda Nairobi West, it's a place Nairobi West.
I
hapo.
grew up in
Wamepanga
Nairobi West.
Nairobi West.
It's so painful. I grew up in Nairobi West.
Yes.
So
Nairobi West ukipita hapo on Friday afternoon kuanzia around 11 o'clock. I used to go because I used to work in Nairobi West quite a lot. Every Friday from around 11, 12, magari zimepangana hapo.
yep, that's
Yeah.
the center.
That is the center. So there is a problem with that, but I think the problem is basically the same mechanism of addiction, just like you can get addicted to other things, and then you are not just like that case that I mentioned. Mzee anapotea kutoka Friday mpaka Monday.
Yeah.
Na mama ndiye anaenda kumtafuta. Aende kazini.
Yeah.
Yeah,
so it's a big problem.
It's a big problem. And
Because
it's getting worse.
some of the argument against this that people bring in, because remember Miraa is kind of like a cash crop, so it's very controversial.
Just like coca is a cash crop.
It's very controversial when you bring it up.
Yes.
Some people will say, lakini Wameru wako na watoto wengi sana.
Wameru wanauza sana.
Yeah.
Wanauza sana. I don't know. That one is very difficult for me to say. But as I said, mechanism, direct biochemical mechanism, we
Yeah.
haven't really established it.
Okay, not established. So it's
Yeah.
still out there, but of course it's an addiction, and
Yeah.
it takes you away from what you're supposed to be.
We have a
doing.
caller, but I'm preparing the caller
Can I ask a
to
question?
prepare your questions.
Okay.
I'll pick up your line ending with 7560. Once the questions are done and asked, then I'll pick your call.
All right,
Okay.
caller, be ready
So-
with the question.
Caller, be ready,
We
por
have
favor.
this question from Nyadimo. Says, Doctor, please kindly clarify. According to some literature sources, uncircumcised men have an increased risk of HPV infection, particularly because of the virus being able to thrive in the foreskin. Is this information valid?
I'm not very sure about that
Mm-hmm.
because when you look at the Western society, most men are not circumcised.
Yeah, Germany especially.
Germany,
Yeah,
most Europeans are not circumcised.
they're not circumcised.
And
Yeah.
we don't have a higher incidence of of HPV there. Maybe because again the knowledge is more available, they are more compliant, and they have the vaccines and so on.
Okay.
So that one I'm not very sure about. I can't give you a direct answer, yes or no.
That was a question.
Okay, and then Diaspora Youth Caucus also had a question. But I think
statement.
but I think let's pick the caller first.
Let's.
And for those who wanna ask a question, the number to call 202-683-4570. Press *5 to speak. We want especially the men to call.
The men will not call. But it's out. We'll ask the questions on their behalf. 7560. Por favor. Are you there? Can you hear us?
Yeah, and please tell us your name and where you're calling from. We can't hear the caller. I think maybe there's an issue.
Hold on,
Hold on, caller.
Caller, are you there?
Are you
Okay.
there?
I'd picked up the wrong.
I am here. Can you hear me?
Now we can hear you loud
Okay,
and clear.
all right.
Loud and clear.
Tell us who you are and where you're calling from, and then ask your question.
Or questions.
Okay. Hi, everybody.
Hi.
This is Facebook name Adhiambo Das. Government name's Rosalind O. WhatsApp name Black Pearl.
Okay.
Black
And
Pearl.
OneMic show Viola Davis.
Okay. All right, Miss Viola.
Viola.
Sasa, the doctor has seemed to answer most of the questions I actually had prepared. But I just want to know what his opinion is. Basically, I'm coming to him based on previous broadcast on the Spice FM show that he did in Kenya.
Mm-hmm.
So number one, I want to know, does he have any statistics on how COVID has affected fertility or infertility? And I'm asking this question based on the fact that I don't know about Kenya, but if you all recall, in the States here, there was a lot of deaths following COVID. And then we would get all these other reports daily almost about how women especially complained how COVID affected their cycles. From a personal experience, I had COVID in May of 2022, and I didn't see my period from April until July. And when I did see it, it was weird.
Mm-hmm.
So
Oh,
my
wow.
question is, do you have any statistics on if and how much COVID affected fertility or infertility, and especially the men?
Mm-hmm.
I have more questions, but I don't know if I should roll them
No,
all
let's
together.
start. No, let's start.
Let me
Let's start with this
clarify.
one. Let's
Yeah,
start with this
Usa,
one, and then
can I
we're gonna go.
clarify what do you mean by weird?
Okay, so all my HIPAA information is gonna be out here, but basically, I used to have a regular period. Now I'm an older chick. Okay, let's just get that right. I'm over 35. I'm over 45, but I'm not yet menopausal.
Mm-hmm.
When I got COVID, I didn't see my period, and then when I got it, I got less than half a teaspoon,
Okay.
and it was not the right color.
All right.
Okay,
All right. Thank you so much. Just stay put at this with your other questions.
After this, then,
yeah, and then we'll come back to you.
Okay, thank you very much, Viola, for that question. No, in Kenya we don't have those statistics. Neither do I have those statistics. Remember, I mentioned about the conference I attended in California. Actually, one of the sessions was actually dedicated to that, trying to analyze and look at the effect of COVID on fertility or infertility, for that matter. Now, having said that, I've had now that you mentioned it, I think about 3 or 4 patients who came to me and they mentioned exactly what you're saying, that once they had they got infected with COVID, their periods actually changed, and I think 2 or 3 of them said the periods, first of all, they took longer to come. That is one, and then after that, the characteristic of the period was completely different. They were heavier and clotier, which had never happened before. So there could be some inference, because now what I'm saying is anecdotal evidence. It's not evidence which is taken from different places. But I think, and several papers have actually been published on that in that respect, where they noticed that there was a slight change, or even there's, as you said, weird change in the periods. So yes, there is a very high possibility that post-COVID can be issues with the periods. In the men, again, this is what we are talking about. Men don't come out. Men don't talk about these issues.
Wanakufa
And we
kisa.
need to talk about that.
And they will not come out and talk about that. And by the way, it is not only Kenyan men or African men for that matter.
Yeah.
I attended a conference, I think it was in Austria, I think 2 years ago. And there was a professor from Denmark, I think, if I remember well. And we had this session again about male infertility. And what he came out, he said, look, I went on a show just like this one. I sent an anonymous message. I said, men, let men call and talk about any issues of infertility that they have, and they don't have to identify themselves. We don't want them to actually to give their names. They just call and say, look, I am a gentleman, I'm so many years, and this is the issues I'm having. And guess what? Not one man called. And that was in Denmark, which is a developed country.
Mm-hmm.
I was sort of happy in a way, if you can put it that way, and I lifted up my hand and I said, so in this respect, we are the same. Whether you are in developing countries or whether you are in developed countries, men don't want to talk about issues of infertility.
Okay.
Hey,
All
okay.
right. So
Viola
there you
Davis,
go. Viola,
carry on.
You had another question.
Can I have, yes. So my other question is, what are some of the attempts being made? Again, I'm asking these questions based on his previous broadcast.
Mm-hmm.
So I kind of had listened a little bit. So what are some of the attempts being made to bring men to the table in relation to traditions and religion that propagate the mindset that mwanamke ndiye shida? Are they having conversation? Are these conversations producing results? So, for example, what I mean is things like the doctor talked about solutions to this infertility, one of them being surrogacy.
Mm-hmm.
Kenyans and many Kenyans don't even believe that another woman can carry for you, or you can use another woman's eggs or sperm or that kind of thing. Yani lazima mwanamke ndiye abebe. So is your organization, is your team, are you with your patients having these conversations? Are they producing results? And what do you think are some of the things we can do as a society to kind of bring men to the table? I think bringing them to the table is going to be hard, but this has to be done because I have family members who are actually going through this, where the male is the actual problem. And I say that because the woman has sought medical help, and daktari limwambia wewe uko sawa, but the man has refused to even acknowledge or even show up.
I hear where you're coming from, and I think your question has, I think, 2 or 3 arms, if I can put it that way. Number one, the discussion about men talking about infertility and their problems, and here we are talking just before we came onto the show that society has sort of socialized us not to talk about these issues.
Yes.
Say, for example, when we are growing up and we are playing football and you fall down, you scratch your knee or whatever it is, and you want to cry. Unalia nini? Wewe ni mwanaume. Men don't cry. So we grow up with this mentality that men have to face everything, without showing any emotions. So you are a macho man. Even if there are issues like this, don't bring them up, because when you bring them up, you're showing that you're weak.
Yeah.
A man cannot be weak. A man is not allowed to be weak. That is the society. Of course, this is starting to change, but is it changing drastically? I don't think so. We are still there. Number 2, we are wired completely differently, men and women. Women will talk about everything personal, very, very openly, with a close friend, or sometimes even with somebody they just met just accidentally. Men, it is impossible, absolutely impossible, even with your very close friend, to say, you know what, I'm having issues, and these are the issues that we are having. It is because you may find your friend saying, you know what, kwani hiyo kazi inakushinda, si tukusaidie. It may be in jest, but it ends up actually having the negative effect. What is society doing? The fact that we are here in the studio talking about male infertility, I think it's a big step. That is number one. There are a lot of men who are out there who are listening, lakini wananyamaza tu, and which is typical of us. When there is such a problem, unasikia tu, what are they talking about? I'll pick 1 or 2, 3, 4 gems, and then I'll go and think about them, and then see what to do about it later on. The other issue you raised is the issue of surrogacy and the issue of using donor eggs and donor sperm. For your information, this is something which is being done very quietly, and a lot of people are doing it, only that they will not say it. And
in Kenya?
I of course in Kenya.
Oh, wow.
Of course, I have very many patients who are using donor sperm, who are using donor eggs as well. Okay. And I have also quite a number of patients who are using surrogates. At the moment, I think I have about 5 of them. And last week, just before I came, I left Kenya on Saturday night. I did a C-section on a patient who had, who had carried a baby for somebody, actually twins for somebody else, And the week before that, I've actually in the last month, I think I've done about 5-6 cesarean sections on surrogates. So it is something which is there. The only problem again is the stigma that comes with it. People don't want to talk about it. The law itself is not very helpful, because what happens is that according to Kenyan law, the surrogate is actually the mother of that baby.
Oh, wow. Okay.
So if you want to use a surrogate, it means that after delivery, you have to get a family lawyer who will actually go to family court and start the process of adoption. So that is something else which actually keeps. We've been fighting for this in the what is called ART bill, Assisted Reproduction Technology bill, which I had the chance of actually being part of the team that came up with it. This is one of the issues that we raised. And unfortunately, it went to this, I think the second reading, it did not go any further. So we were thinking about separating surrogacy, because quite a lot of couples would want to make use of this process. But because we don't have a law which favors them, they sort of, get cold feet and they don't use it. So yes, there is a problem. We are trying to address it. We are trying to talk. There are some groups I know where the ladies, again, as usual, are the ones who are leading, but they actually are bringing their men on board as well. I was invited to one such outing, and actually the men were very happy. They said, at least now here we can talk amongst men about male issues, and I thought that was a good step. The other thing which I can suggest, and which we are trying to do, and I've done a little bit about, is using the church, because I think Kenyans are church-going people,
and the mosque
as well, where they can actually articulate these issues and say, look, there is a problem, and let us use this avenue that is available to discuss these issues.
Now, when you bring up religion, there's a very like now coming from a Muslim background, there's a lot of like the Quran usually has a lot of information on some very small details that people thought it would not have information about. There's a scholar who lives here in the U.S. I think he lives in Tennessee. It's called Yasir Qadhi.
Is that our boy?
Yes. Yeah. He has a topic. He has a conversation on this, which I'm gonna go and listen to, because it talks about like some of these taboo topics.
Yes.
And what actually the Quran says, what the Hadith says. Like what the Prophet did. He has a very interesting way of merging, like those religious texts,
very interesting,
to what's happening today,
absolutely.
And even talking about what certain scholars said and everything. And I think because there's a tendency sometimes in, I'm not going to say in the science community, but people who believe a lot in science to dismiss the faith community.
Yeah.
And there's also this tendency to dismiss that this is women or this is men. And that's why I really like the way you're bringing this, whereby you're not trying to throw blame on people, but we should handle it as a societal issue. Yeah. So I think that would be, especially from the theological perspective. I see people like like my uncles, my aunties, the older generation. I see this resonating with them so well, rather than having it in an academic setting.
Absolutely.
Yes.
Rosalind.
Okay.
Yes.
More questions? Pause. Continue.
I do. I got it.
So that's our last question. Do you have any other callers?
We have, but I'm waiting for the caller to confirm.
Okay,
But,
yeah.
we have another caller.
So
Yes.
number is 202-683-4570.
Yes.
Press *5, and it's okay to be anonymous. Even
It's
if
okay.
I ask you for your name and you want to be anonymous, that's okay, because this is a very sensitive
Okay,
topic.
hold on. You wanted to read a comment?
Yes.
Okay,
A
read a
question,
comment,
actually.
a question. So ask that, and then we'll have a question from Black Pearl.
All right.
Uko, you need a pen and paper, sir?
No, it's okay.
Okay.
Good.
You're
He's a
smart like
doctor.
that, huh?
This
He's
guy
a
just
doctor.
He's a
he
doctor.
has
And
no
a
pen.
lecturer.
Oh, by the way, just to let guys know,
Yeah.
this is the first time we've had 2 doctors on the show.
Yeah,
Brothers.
There's one who's off camera.
There's one who's off
There's one
camera,
who's camera shy.
computer science
Yeah.
doctor.
Yeah.
Then we have a guy who studied in Poland and worked in Brito, which I did. We're gonna.
Yeah.
that-
And for the listeners who are joining us, this is Dr. Kireki Omanwa.
Yes.
And he's an OBGYN and fertility specialist. He's a renowned fertility expert and a senior lecturer at the University of Nairobi's Department of Obstetrics and Gynecology. So this is the person who's talking to us today, Ruth.
Studied in Poland, worked in Brito. Right now, he is the man.
His resume is so long.
It's long.
I just had to
Masama, you
pick-
know what?
Yeah.
You sound like Lewis
Yeah, I have to
bragging.
Sound like
pick.
we are scared, bro.
Yeah.
You
Yeah.
sound like Lewis bragging.
But we are bragging on it.
Get to the
Bragging on his behalf.
We are bragging
Yes,
on
we're
his
bragging
behalf.
on his behalf.
We are bragging on
I
his
will
behalf.
say-
What
doctor,
is?
Doctor has just been giving information.
What is?
That's all.
Omera, what
All right.
is? Okay,
Ruth.
sawa.
I would say he's very famous. Watch any channel on TV in Kenya and you will find him. Stephen Batty says surrogacy is a good topic to discuss. Great. Then somebody says in Kenya and Africa, this topic is a societal class. Surrogacy and I think somebody asked karaoke.
I think there's a story for that.
So I ask, what class are we talking to or about?
Now-
And also, if you don't mind, to clarify. So of course, address that part, but also, are you seeing people who don't have the means wanting to do this, and what avenues can we make it easier for them to do that?
And just to piggyback on this issue about cost, because this is one of the things that I
Very
wanted to talk
costly.
about.
Yes.
Fertility treatment is very expensive.
Yes.
I haven't even looked at the pricing, but I can tell you it's a very expensive affair. So
He can tell us. He can tell us.
yeah,
Not necessarily how much he charges, but
like both in Kenya and here.
Yeah.
So maybe what I want you to talk about as far as the cost is concerned
Yeah.
is what is insurable in the Kenyan context and in the American context, if you're familiar, and what has to be paid for out of pocket. And for those people who can't afford it,
Yeah.
like what options do they have?
I think over here, Viola, pause on that question because I
Yes.
think this
Yeah.
guy has been loaded with another serious question.
Yes, cost.
Okay,
Yeah.
but before we get to cost, can
Yes.
I just chime in? I don't know if I can combine these 2 questions. Like I said, I have so many questions, but mostly based on his previous broadcast.
Yes.
One of them, I think I had posed to you guys. So I told a story about, I know of a couple that was together for a very long time, about 10 or plus years, and then they could not conceive.
Yes.
They were married, they were happily married, and they couldn't conceive. And then as soon as they broke up and went with to marry on other people, they were able to establish individual families, both of them, the man with another woman, the woman with another man.
Yeah.
So is the idea that maybe fertility chemistry for some couples just doesn't exist, even if they're not cheating, they're not playing away matches or whatever?
Zero grazing.
Number one. zero grazing or all that. Number two, the other question being, again, on the previous broadcast, he mentioned that certain things about the diet, such as vitamin C and E and zinc, help to protect the sperm and improve the fertility health of the sperm. So their motility, their strength and everything is okay. Are those the same vitamins that women also need to be able to have in their bodies to be functionally, reproductively functional, or what is the difference between the diet that men need and the diet that women need? So I know that's loaded, but please answer about the myth and the belief that sometimes the tadpole and the bean are just not communicating right, and the diet for the women in relation to the men.
Let me start.
Thank you,
with
Alice.
Let me start with the question about the couple who were married for 10 years and they were presumably, zero grazing and nothing happened. They broke up and individually they went and had babies with different partners. Yes, it does happen, especially what we call the mucus in the vagina can actually be quote unquote dangerous to the sperm. It can actually stop the sperm from swimming, and that will obviously make this couple infertile. But immediately they separate and they go and have other spouses, and that problem is not there. And hey presto, I have a child, and the gentleman has a child or children, and the lady has a child or children as well. So that one is a well-known phenomenon. They used to do a test, what is called sperm penetration test, very historical, whereby a couple would have intercourse, and then after 2 hours or so, they would get the fluids from the vagina and actually go and examine that under microscope, and then they would see whether the sperms are swimming or they are not swimming. That one is not done these days because it's more historical. We don't do it. But there are other ways of circumventing that problem. If we suspect that is a problem, we can do what is called intrauterine insemination, where we get the gentleman's sperm, we clean it, and then we do a direct, call it a direct injection through the cervix and into the womb.
How do you clean it?
There are special chemicals in the lab. Okay. So you're washing a maji at it.
I was going to ask.
That's beyond our knowledge.
It's good to know.
Special chemicals. Now, the other question that you asked was about about cost.
Cost and and
about
accessibility. Sorry.
Mm-hmm.
Sorry, say that again.
Okay, so Dr. Omanwa mentioned that vitamin C and E and zinc and a couple of other things ukikula malenge.
Yeah.
It helps with the sperm health.
It does.
So the motility, the strength, all of that.
Yeah.
So my question was, is this the same situation for the women with the same vitamins, or is there a different level of needs in terms of vitamins and things that women should eat to help with their ovaries and all that, the eggs to be able to, for their reproductive health, basically.
That is all right. Now, in terms of diet, obviously, eating a nutritious diet is imperative, and it is important when it comes to matters fertility. For the men, there are things which are specific. What we are looking for selenium, for example, foods which are rich in zinc. Vitamin E is very important. Vitamin C is also very important, what we call antioxidants. For example, L-arginine is also very important because this goes into, let's call it into the whole factory of producing sperm. Sometimes even vitamin D, more in the women than actually in the men. You may find that there are some tablets which have all of this, but in different proportions, and there are specific proportions which we will need for this. When it comes to the females, we need more of vitamin E, vitamin D, and sometimes some of the foods that we eat. In the men, we know that pumpkin seeds have a lot of magnesium, have a lot of zinc, have a lot of selenium. Flax seeds have a lot of L-arginine and so on. So it can be different, even though if a lady used the flax seeds and marker. There are different types of marker and so on. To try and enhance the fertility would not be a problem. The only issue is, Viola, in order for me to tell you that 100%, if you take marker for the ladies, for example, and flax seeds combined, they will increase your fertility by X%. That one I cannot be able to tell you. Why? Because there are no studies which have been done. And when you talk about studies, we are looking about randomized controlled studies, whereby X number of women have been given marker, a group of women have been given marker with flax seeds, and so on. And then we need to check what are their fertility rates and what are we looking at in terms of fertility rates. Are we looking at what you call antral follicle count? Are we looking at their hormone levels and so on? So that one is a little bit of a difficult experiment to do, but it is just generally accepted that some of these seeds that grow naturally, yes, can help in terms of fertility. Coming back to the questions Ruth asked, Ruth and Ali asked about the issue of cost of surrogacy and cost of treatment.
Yes.
What treatment is actually insured or can be paid by the insurance. I'll start with the second question of insurance. Unfortunately, in Kenya, when it comes to treatment of infertility, it is not insured. You have to pay through your pocket.
Out of pocket.
Which I
100%.
think, which I think is discrimination. It is not fair. It is not right. This is 2022. From 2016, 2017, I think, to 2019, NHIF used to pay for treatment of infertility, especially IVF, for government workers only.
Wow.
Yes.
Okay.
Yes. So if you're a civil servant, you are in the police, you're in the army, civil servants. The army is completely different, has a different system. The government actually paid for it. And then they stopped in 2019. I think 2019, towards the end of 2019. So from then till now, it is not being taken care of. Talking about cost, unfortunately, most of these, remember you talked about the 20% of infertility?
Yeah.
Most of them are at the bottom of the pyramid. I work in Kenyatta National Hospital, and we have clinics every day except Friday, where they have an oncology clinic. And we see about 10, 11, 12 cases of infertility almost every day.
Wow.
Every day.
Okay.
Most of these ladies that we see are ladies who are young and who do some, laborer jobs. So even if they earn 15K or 20K a month, they will not be able in their lifetime to be able to afford to have treatment of IVF, for example.
Yeah.
IVF costs about anywhere between 450, sometimes to 600,000 shillings per cycle. And in IVF, when you talk about treatment of IVF, is where we inject the patient with medications every day for about 10 to 14 days. And then we harvest, quote unquote, we harvest the eggs through the vagina. And the husband gives us sperm. We clean it. And then we take the best sperm and create a baby, create an embryo outside, and then later on transfer it.
And when you say for 50K to 600K per cycle, does it mean that this has to be done in multiple cycles? Or
sometimes you may have to do several cycles.
Yeah.
And
but
what several? Is it like 5, 10?
It again all depends.
So it's just very expensive.
It is expensive.
Okay.
So if you are younger, where younger we mean maybe you are in mid-20s, 30s, before 35, where naturally you will produce more eggs. So we'll create more embryos and we won't transfer all of them. We will freeze the others for future use. Then it becomes a little bit cheaper in the sense that the following subsequent cycles, it doesn't cost 400, that between 450 and 600. It may cost about 200, 250 for what we call a frozen embryo cycle treatment.
Okay.
Now, in the US.
In the US, yes. That's what I wanted to ask you.
In the US.
Yeah.
In the US is very expensive as well. Costs anywhere between 15, sometimes even up to 20, up to $30,000 per cycle.
That is
Wow.
according to Shady Grove Fertility, by the way. in
Oh, Shady
Maryland.
Grove, yeah, because I
Yeah.
know Shady Grove
Shady
is
Grove.
known for that.
For
Yeah.
fertility
that.
clinic, yes.
Yeah. Now, are there some insurance companies that pay for this? Yes, there are some. I don't know, but I have read, in literature that there are some companies which actually take very good care of their patients, and they actually cater for IVF treatment. Not many, but they're there. But by and large, this is something which you have to pay out of pocket.
So you're better off, even going back to Kenya
Of course
to
it
try
is.
and do this
Of
in
course,
Kenya.
Of course,
Okay.
of course, it makes economic sense.
And
Most
going
likely.
back and seeing Dr. Omanwa.
Oh,
Yeah.
karibu sana.
Ah,
and then
okay.
the other thing is that apart from creating those embryos, there is a freezing phase. And then later on, if you, for example, left, like I see some patients come and they say, oh, I went to India, I did a cycle there, whatever it is. So if it didn't work and you want to do another cycle using the embryos that were frozen, remember they were frozen in India, for example.
Yeah.
So you have to go there,
Mm-hmm.
say for about a month. There are costs, traveling costs, accommodation, etc., plus the process itself. So the whole costs end up becoming extremely
Right.
expensive.
Yeah.
Yeah, but if you do it at home, you don't have to accommodation uko mahali ambapo uko. There are no transport fees, etc. So it's a lot cheaper at home.
For how
Okay.
long
So
can
just-
you store
Oh, sorry.
the eggs?
Sorry.
How long can you store the eggs?
How long can we freeze the eggs? We can freeze the eggs, we can freeze sperm, we can freeze the embryos. We can freeze them for 5 years, 10 years if you want. I think 2 years ago, there was a case report which was reported where an embryo was frozen for 21 years.
Oh wow.
And it was thawed, transferred into a lady, and she delivered a baby boy.
Okay.
After 21
Now,
years of freezing.
and just staying on this cost issue, because this is a very big, it's a very big deal when it comes to, routine medical care and even specialized medical care like
Yes.
this. So there's clearly those people that you're dealing with at Kenyatta National Hospital who
Yes.
definitely will never be able to
Absolutely.
to afford this. Now, traditionally, there were certain, unaambiwa kula matunda fulani ama tumia sijui mwarubaini ama
Yes.
tumia nini.
Muganga.
There are some traditional there's certain traditional
Herbs.
remedies which I think are controversial in the sense that sometimes people who've studied a lot of Western medicine look down upon them. But we also have to remember that Western medicine is fairly new to most people in Kenya. When you look historically,
Yeah.
there are people, who as recently as even as the 80s, never had hospitals. They had their own cures. They had their own ways of doing things. And there were certain things that were working.
Yes.
So are there any natural, traditional substances that you could maybe recommend to people who definitely know they have this problem, but they can't afford it?
Now, even before going to the recommendation of a herbal medicine, by the way, herbal medicine is something which we have not done enough research into. Today, I was reading a newspaper, and there is a tree called Prunus africanus, which is actually which actually treats many things, and one of those things that it treats is cancer.
Wow.
Yeah.
Okay.
And it is known.
Yeah.
Now, what people have done is that they have harvested the bark, they harvest it, they send it to other countries where it is processed, and then it's sent back.
Oh.
So what one lady has decided to do, especially in the Badawy region, Nyandarua region, is that she has been harvesting the seedlings of this Prunus africanus, and she's actually encouraging farmers to plant these trees, which is fantastic. Because these are some of the avenues which we are not exploiting because we don't know them. Coming back to infertility and the issues of herbal medications, I have no issue with that at all. The only problem is that some of these aunties, when patients go home, they say, my auntie told me, anakupatia kibuyu kimeja. Enda unakunywa glass moja kila siku. Now, which type of glass? Because if I take this glass and I take another glass, they are different in terms of quantity.
Yeah.
That notwithstanding, we do not know what is the chemical structure that is actually in that concoction. How does it work? What is the half-life? does it produce any side effects? What is the quantity that is actually active in that glass, and so on? So when patients come to me and tell me that they're using or they've been using herbal medication, I don't have a problem with that. I only tell them, you say, I wish we knew exactly what is there, what is the active ingredient, how it acts, and so on. So more research is actually needed into that. Because I have not studied herbal medicine, I cannot tell anybody that enda ukunywe mwarobaini ama ukunywe sijui hii na hii itakusaidia.
Okay.
So I have no problem with that. The only thing is that let's take a step back, because you don't know what is there. Let us use this what we know first. If the herbal can be complementary, that is also okay.
Okay.
Now
Uno.
we have a few comments.
Yes.
Thank you, Viola. But I think we also have another caller. I'm waiting for him to call.
Okay.
Well, he's gonna call, but you
I'm
read some of the
gonna
comments.
read some of these
Yes.
comments and some of
Yes.
the questions we have.
Mhm.
So so I'm gonna read all of them. So does a good doctor absolutely see a role that psychologists can play in infertility? In Kenya, is there any psychological care given to individuals who are infertile and seeking ART avenues to conceive? That's one. Asante sana Rosie for your question. To Dr. Very interesting ones. Glad that you're doing okay. Is it true that some women that some men's sperm, actually maybe make it general, men's sperm can throw off the pH of a woman's vagina? And how is that related to yeast infection and BV? The other one is atawambia BV ni nini. Most of us know this procedure is based on
Bacterial vaginosis.
I can't even pronounce it, but thank you. What are the legalities, environment, including the procedural cost? I think Elolota, can you please clarify that? Then he goes on to say, hii ni mambo ya watu wa Runda, the people who are able to afford.
No, but that's true.
That's true.
Unfortunately.
Kindly touch on this topic. It's about the trackers. I think Diaspora is talking to...
No, Diaspora
guy.
had a question, which was the trackers in the United States
He
don't
said they're
sit
separated.
on the engines. They're separated from the operators as opposed to the trucks in Europe and the rest of the world. But they have issues with food and other challenges. So I guess, it was just back to
Just
that
in
question of the
connection with
trackers.
that,
Yeah.
Then Slay says, I switched to taking herbal supplements. To my surprise, my periods became regular. But before this, it was so irregular. Slay, would be nice if you can tell us what herbal supplements you're taking.
So we start with which question?
We
Ruth?
start with, I know that too many. Let's start with the
Can I-
pH,
Yes.
and then we'll go
Can I-
to the psychologist.
Okay. Now,
Hold on.
Okay.
In
Yes.
addition to Slay's question, and
Yes.
then I'll get off the line because I have a boatload. Daktari mentioned elevated levels of androgens, which also lead to high skin sensitivity and low egg quality in women. So I just want to know what treatments are available for those women who struggle with that issue. And I just wanted to also mention that my grandmother, who is 100 plus years old, she's really sick right now. She was a village midwife, and she gave me a herbal supplement one time for my very, very painful periods. And I'd like to mention that worked. But that's a story for another day. And lastly, and I promise I'm getting off the phone, Ruth Kilungu.
Yes.
Ile mambo ya pombe na Wakenya is a real deal. 1 liter is nothing. Yeah. If you doubt me, ask OneMic. Anajua story yetu.
Allah.
Kwaherini.
Okay.
And thank you, Dr. Omanwa.
I think
So
that needs
much
another
great
episode.
information.
Yeah. I think that needs another episode. But doctor, twende
Carry
kazi.
on, sir.
okay.
pH
What?
psychologist.
pH psychologist. Okay. With the psychologists, absolutely. Actually, we need to have these psychologists because, first of all, the process itself is very emotional for the ladies most of the time. The men, we are removed because we are not the ones getting the injections. We are not the ones being taken to theater for egg collections. We are not the ones, having a transfer done. We are not the ones who are saying, Allah, the test is negative. Sawa sawa. So it's, I think it's very important. Do we have psychologists who do this? There are a few of them. And are there psychologists in every clinic? No, there are no psychologists in every clinic. Even in the UK where I worked, there were no psychologists in every clinic. The psychologists would come in when we were doing an embryo transfer from, let's say, donated embryos or a surrogate. Then the psychologist actually came in and did an assessment. Okay, so yes, there is a lot of room for improvement in that respect. Okay. The issue of pH is there sometimes some men who can throw, quote unquote, throw off the pH in the vagina. God has created it in a very wonderful way, in the sense that in the vagina the pH is acidic, very acidic. The pH in sperm is actually alkaline. When they meet, it becomes neutral, so that the sperm can be able to swim and get to where it does. Now, yes, it does happen that some ladies, after having intercourse, they do actually have some infection. And I've met a patient who, every time she had intercourse with her partner, had a bladder infection. So I don't know whether that was something which was specific to this lady, or it is something which can happen, in other ladies as well. Sometimes it can happen because if the guy has an infection and comes and has intercourse with his partner, that can aggravate actually the infection in the vagina. So yes, it can happen that way.
Okay.
All right.
Okay.
Yeah, thank you.
All right.
What?
So there was another question too that,
Yes.
that came on the
Viola.
like on the comments. Was it from Viola or
Which
She
one?
mentioned, I think she asked about androgens, elevated androgens,
Yes, that was
Yes,
androgen.
that
What-
was, yeah.
and what can
And
be
what
done.
is that?
And androgens are basically male hormones.
Okay.
The testosterone is a male hormone. Estrogen, progesterone, these are female hormones. Now, with the male hormones, there can be, women have male hormones and men have a small amount of female hormones as well. Now, the issue becomes a problem when the male hormones are slightly more than where they're supposed to be. So first of all, even before treating the androgens, because we don't treat the androgens, we want to find out what the problem is, what is the cause of these androgens being elevated. One of the causes that actually leads to androgen elevation is what we call polycystic ovarian syndrome, where the biochemistry in the ovaries is not doing what it is supposed to do, and you have this elevated androgens as one of the signs. And the secondary, impact, you may have these women have, for example, the skin is very has a lot of acne. They may have hair where it's not supposed to be. The upper lip, they may have a beard, they may have hair around their nipples and so on. This is actually a problem which affects about 10% of all the women who have an issue with infertility, especially the younger ones. So that one is a completely different kettle of fish, as it were, and it is addressed differently. You may have what is called a tumor, testosterone secreting tumors, and this will increase the level of androgen in the body, amongst other things. So we need to find out what the problem is first of all before we start treating it.
okay? So it's something that needs to be
Diagnosed.
it's a
properly.
process,
Yes.
It's not just something that you can pinpoint and this what needs to happen.
Yeah.
Now,
I have
like
a question myself.
okay, now before you get to your question, we're getting to that point where we're close to wrapping up. Do you still have a caller? Ama bado hajapiga simu?
I think caller alingoja, but ni sawa tu. Tunangoja nini? Let's carry on.
Okay.
Yes.
All right. So real quick, ask the last question. We're about to wrap up now. Because go ahead.
So we left this HPV conversation somewhere hanging. I need to come back to it, and the fibroids topic too. But I think that the one you did address it in the sense that there are several steps to treat this fibroids, to the treatment plans for them. Although in surgery you might decide this is not a good idea, just remove the uterus, and that is just it's a risk in any surgery people are doing.
Yes.
HPV, you did say there's pushback about parents saying we don't want to have girls vaccinated because this is going to make them promiscuous. But now they've introduced the male vaccine, and there is also pushback to that. How do we help people see the importance of this?
Number one is to change, because we have to talk about this. Remember when the HIV was discovered? Nobody wanted to talk about HIV.
Yeah.
And it was a taboo subject.
Yes.
And you'd see guys who are withering and became a Slim's disease, and later on they die. And it harvested, from the lowest to the uppermost echelons of society. But when people accepted and people started talking about it, music, music stars, film stars, politicians, etc., started talking about HIV, and then later on they discovered that we can give them medications, and these medications, can actually increase the survival rate. Magic Johnson, you remember when he came out and said,
Yes.
I'm HIV positive, and I'm taking these drugs. It was a huge boost to what HIV is. So nowadays, I see couples who are HIV positive. So what? That is the attitude.
Okay.
I'm HIV positive, so what? And actually, most of them, you will never see an HIV patient who is that thin and Slim's disease or whatever it is.
Yeah,
They're
that
not.
disappeared.
It disappeared.
It totally disappeared.
It disappeared.
Yeah.
However, we do see some of these patients. Some of them are tragic. Very young girls, 19 years, 20 years, 23 years. They come with cervical cancer stage 3, stage 4. Yes, they do.
Wow.
Yes, they do. So
And
this
is HPV related.
usually when you have HIV, the HPV related, cervical cancer comes a lot earlier, because you remember your immune system is
it's down.
completely,
Yeah.
completely down.
And, okay.
So this is what we need to talk about.
Okay.
And we need to start talking about it actually from primary school, secondary school, even in university. But we don't do that.
Reproductive health.
We need to talk about reproductive health. We need to talk about sexuality, age-appropriate sexuality education. But again, there is pushback, especially from the church. Say, don't talk about sexuality education. You will be over-sexualize our children. Don't talk about contraception because you want our children to be promiscuous. Don't talk about IVF treatment because couples are supposed to have children naturally the way God intended, and so on. And the consequence of that is that we are having in Kenya today over 20,000 adolescents pregnant. Between 14.
Because we're not having sex education.
Because we are not talking about it.
Yeah.
We are not talking about it. So coming back to your question, what do we need to do? We need to talk about it in every social, forum that we have. We need to engage experts. We need to talk with the religious leaders, the imams, the sheikhs, the priests, the pastors. We need to talk with the educators, the teachers as well. First of all, equip them with knowledge, and then now let us talk about it. Of course, the results will not be there tomorrow. The results will be after maybe 10, 15 years. When we see that cervical cancer, which kills about 2,600 women every year, actually reduces. And it will reduce by some of these preventive measures that we put in place.
Now, I know, Daktari, in addition to what you're saying, I think it's good to even provide context in terms of educating our youth.
Yes.
Because listening to one of his interviews, he talked about a 14-year-old girl in Poland, where he, by the way, got his training and graduated from. In addition to that, maybe you can touch on that in terms of educating our kids, because there are certain myths, there are certain urban legends that circulate among our kids, not even us, even as adults, that can affect. And maybe you can maybe if you don't mind retouching that story about the 14-year-old.
Okay, as you do that,
yes,
another addition to that, because the male vaccine HPV just came the other day, and men up to 45 are eligible to take it. Can you just give them a call to action?
Allah.
Because I got my vaccine
Yes.
at 23. I did not even know what it was. My doctor told me this is important for you to take it
Yeah.
before you ever become sexually active. So like I was like, okay, my doctor's telling me to do it, let me do it.
So let me do
But
it.
but then men, because it's very new,
Yeah.
you all need to go get this vaccine.
So at 23, okay, so I'm just doing
no,
mathematics.
I
sorry.
was not sexually active.
No.
I was just given
Eh.
the vaccine then.
mathematics. I was just doing mathematics. Daktari, carry on.
Okay.
Let's start with Poland.
Now,
because we're
I'm,
loading Daktari with
yes.
so
Too
many
many.
questions. Yeah.
Yes.
Yeah, this is a well of resources and
I-
source and information.
I got a scholarship to go and study in Poland. When I arrived in Poland, I did not know a word of Polish. I only knew two things about Poland: that the capital was in Warsaw, and that the Pope at that time was actually Polish.
John
But then,
Paul.
can you speak?
John
Can you
Paul.
say something in Polish?
What do you want me to say?
Anything.
Anything.
Omode Twegoko. Here, we are here today.
Dzisiaj jesteśmy tutaj, razem,
Oh
prawda,
my-
dyskutujemy
Oh.
nad tematem, którym jest bardzo skomplikowany.
I totally agree with you.
Hey, yo, you are on point like a decimal, bro. Ni sawa tu.
Ni sawa.
But
Ni
even your
sawa.
matusi iko on point.
Ni sawa. Yeah. So I think that's actually that right there. That's a story in itself for another day.
By the-
Yeah, but you're talking about
Yes.
yeah, you're talking about how you arrived in Poland.
Bastusta and all that schmack.
So I was working in Poland, and this mother brought her daughter to me. It's 14 years. So as I was taking the history, and they told me that they had taken her to a pediatric hospital because she started vomiting, and they didn't know what the problem was. So she was taken to this pediatric hospital, and believe me, they did all the tests that are possible. They even did what is called a gastroscopy, putting camera through the mouth and into the swallowing duct, into the stomach, to see whether there's a problem there. And they couldn't find anything. They transferred her to another specialist hospital, try and find out what is wrong with this girl, who wherever she eats, she's puking, and we can't seem to find the reason why. They did more tests, all of them were negative. And then one of the doctors said, you know what, why don't we just do an abdominal scan? Because we've done all the tests and we can't find a reason why she's puking, 3, 4, 5 times a day. And when they did a scan, there was a beautiful baby growing in the uterus. I think it was about 15, 16 weeks.
Nobody
Said
thought of
this
asking.
girl is pregnant. Take her to a gynecologist. Nobody thought
doing
to
a pregnancy
ask her.
test.
Nobody. I mean, she was 14 years old.
Yeah.
Did
And
she have a
nobody-
period?
Nobody asked her about her last period because I think the mindset was she hasn't started her period.
Yeah, she's 14.
Or
and
she will
She's-
not be engaging in this.
exactly. Yeah,
Okay.
she's 14. It's
So,
natural not to think of that. Yeah.
Absolutely. So when she came to me, I asked her, it sort of, hit me. And I asked her, did you ever have in school, they ever teach you about sexuality education? She said, no. I said, what about your friends? You said the myth that was circulating amongst our friends was that if you have intercourse standing up, you can never be pregnant. And she had intercourse
Wow.
standing up under the stairs, by the way. Under the stairs. And she got
Sorry.
pregnant. And she got pregnant. So it has stuck in my mind. This is what we need to talk to our children about.
Mm-hmm.
Not to wait until they're in the first form in secondary school or whatever it is.
Yeah.
We need to start to discuss these issues when they're in primary school.
Yeah.
That is why I said age-appropriate sexuality education.
Yeah.
That when they see this happening, this is what is happening to your body. When you start seeing the breast starts coming out, it is not an issue. This is a natural process. We need to open these discussions in our homes. What used to happen in the past was that we had aunties and uncles, who would sort of walk you through this. Your first period, they'll come and tell you, that is normal. But the aunties are not there now.
No.
The uncles are not
We
there now.
don't live around each other.
We don't live around each other. What we have now are our peers. And our peers, of course, will give you information most of the time which is wrong. And something else is the internet. Of course, it has huge amount of information, which at that age you don't know which one is okay and which one is not okay.
Don't know how to process
So
it.
we as parents,
Thank you.
we need to talk about this. In my family, because of by virtue of my profession, this is something which my daughters have had me talk about, about this. They've had me talk about how are your periods, when did your periods start? Or, doctor, I did a test and my sperm test result is not good. And I start explaining, So by virtue of that, it sort of came out naturally. My daughter knows everything about IVF. I mean, she can talk you through IVF because she's been hearing me talking, asking questions. And my son also the same. So I did not have that problem. My wife also sat with them and walked through this with them. But how many parents have that chance? So we need to shed this thing of shame that having a period is shameful. There's nothing shameful about it.
It's a natural occurrence.
It's a natural process. Because without that period, then this young man would not have been here. So we need, like yesterday in capital letters in red, we need to talk to our children. We need to discuss, not talk to them, but discuss with them,
and
because they will have questions.
Yeah, and I actually know some organizations that are not only, because this thing of distribution of sanitary towels,
Yes.
unfortunately it's become like the cool thing to do. So you have a lot of people who are doing it just for the photo ops,
Yes.
but then you have some good organizations that are actually not just distributing them, but they're going into schools and educating like the girls and talking to them about it. And even within those same schools, they also go talk to the boys about it, which I think is a good thing.
It's
'Cause
very
there's
positive.
there's a government program for distribution of the sanitary towels. I don't know exactly how that works. I don't know whether it's just, like this school receives this, dump them there and then go. I don't know how the government program
Can I
works.
talk to that?
Okay.
Because in primary school, from when I was in class 6, and that's why, as Rosie said, my IPA information is out here for everybody to know. I am a brand loyalist of always for sanitary pads. And the reason is they would come to school, they would walk us through, of course there was biology, but having this person come with pads and they'll give them to us for free. I mean, they'll give them to, even before your period began, they will walk you through how to wear it, like how you put it on your on your panty, the entire thing. They will show you ikija inakaaje when you need to throw it out, So like from that I became very comfortable knowing what to do. So I think that, and then out of that conversation, then you're told, so umeanza kupata periods, these are the things you need to be careful about, and I think I like there were programs, but of course there was a brand coming to but I would say it's made me a long time
and just
customer.
piggybacking on that story, it takes me back to when I think I was in class 5 or 6. I'm not sure whether mom is listening to this, but there was a time when this always commercials were coming on TV, and there was a day when family too, there were other people, like cousins, or just a lot of people at home. This commercial came on TV. I'm like, what is this always thing? Na nikauliza hapo, like when everybody was there. Yeah, I'm like, hii kitu ni kitu gani there? Wanamwaga ink nini? Yeah, I mean, there was an aunt of mine who gave an answer, but it was just an answer to brush off that topic because, but I'm thinking, like, because I was a curious child. So I was asking, but later on is when, like I got to know, I got the answer from friends in school. Because, in school, there's always that kamjuaji, like who has more information. So I think, like we need to have structured ways of which, because the first teachers to children are parents. Whether you like it or not, you're the first teacher. So we probably need to educate parents on
especially mothers.
Yes, and mothers especially, how they need to talk to their kids. And then, of course, the teachers in school, the community, the community structures, the churches, the mosques, and other places where people go. And even the places where men go, because there's that issue. The easy thing is to say, like men are just irresponsible, they don't want to do this. That's a very easy thing to say, which is very popular and people like throwing it out. But I like the qualitative approach that you take, whereby we try to find out the problem, because you've gone around the world, you've discovered it's a global issue. It's not only an African issue. So there's definitely something that's not being done right, which needs to be addressed. And as we come down to wrap this up, we're gonna get there, but you know, like we're running out of time. But as we just get to wrap this up, I want to know, is there infertility that's irreversible, meaning umefika mwisho? You know, like there's nothing that can be done. I have all the money in the world. I have everything that's needed for treatment, but there's just nothing on the other side.
But soldiers wamegoma. They're on strike.
Okay, even if the soldiers are on strike, we really can't say that sasa tumefika mwisho kabisa, there's nothing that we can do.
Yeah.
As you said, you have all the money and you have all these. The options are there.
Okay.
So you say, okay, if the issue is sperms, the number is not where it is supposed to be, motility is not where it is supposed to be, the normal forms are not where they're supposed to be, we can give you medications. We treat that. If the issue is blocked tubes, for example, we can circumvent that by doing IVF.
Okay.
If the issue is age, especially for ladies 35 and above, where the number of eggs has reduced, the quality is poor, we can circumvent that by using donor eggs. If the issue is azoospermia, there is no production of sperm, we can suggest donor sperm. Sometimes we use donor sperm and donor eggs, and the wife, the lady carries the baby.
Okay.
Sometimes you can use donor sperm and donor eggs, and we use a surrogate. If there's a problem with the lady, for example, she's had brain surgery, for example, she's had cardiac surgery, for example, or she had her womb removed, for example, where she's not able to actually carry that baby, or she has had a series of miscarriages, 5, 6, 7, 8, 12. Had a patient who had 12 miscarriages. So that one, there is a problem somewhere.
Yeah.
So we can sort of circumvent. There are ways we can circumvent these problems.
So the key is for people to have an open mind.
Have an open mind and come, and we talk you through the options.
Okay.
So we shall see that you cannot have quote unquote what's called biological child, is you can have donor eggs, donor sperm. Then you can have a baby.
You'll have a baby.
It will not be biological as you'd want it to be, but it is a baby.
The moment that baby starts kicking in your womb, it is your baby.
It's your baby. Yeah.
It is your
No, what I meant by that, because people do try to like lazima we wangu, in the sense like damu yangu, like you know, for my DNA, so to say.
That is true.
And you know, in African society, people, a lot of times people used to raise kids who are not their own, and it was a very normal thing, you know, like and you know, like even within our family, sometimes we've grown up, and then that's when you're told, oh, Flani, you know, like was not even part of the family, alitumwa tu Nairobi kuja kusoma, but the way they were brought up,
it's like
they were brought up like part of the family. So
if I in that same vein, there was research which was done in the UK, and similar research was done in Kenya. Can't remember whether it was 3, 4, 5 years ago. 34% of the children that we bring up, men, they're not ours.
Wow. I think we need another show for that.
Many ateke.
34%.
Daktari anakuja na violence.
I think those are standards from Suneka. Those guys.
34%. Soma DNA zikifanywa kuna vile kutakuwa na surprises.
Because remember what Daktari said. 20% Africa.
Infertility.
Men infertility.
Men is about 35 to 40.
Oh, 35%. So understand one thing. If you're in a relationship na bibi hashiki, you can't be blaming her fully. What you need to do sometimes is look in the mirror. That is one. Two, go to a specialist.
Yes.
You need to find out one, if your soldiers wako, if either they are Usain Bolt, Omanyala, or if they
Kipchoge.
are Kipchoge, or
Boy.
wanafanya hivyo tu wanazurura
rotating on your own
hapo tu,
axis.
ama
Yeah.
wamedoze as in nothing.
Hawaendi mahali.
Haendi mahali.
Yeah.
Sino daktari?
Yeah.
And it is important because many people, all of us, we go into relationships thinking automatically
Everything is okay.
everything is okay.
Yeah.
And I remember one time, Dr. in one of his interviews, like some of us guys are told, wait, by the way, don't cry. Because when ni mwanaume.
Yeah.
And then on top of that, hata ukiangalia dem vibaya anaweza pata mimba. Unakumbuka ile story ya Makamende?
I know, yeah.
If you kiss her,
Makmende.
ukimbusu hapa, anaweza pata mimba. Be careful. Only to find out that, wewe, gutire, soldiers, nonsense, the whatever did not descend. And we, like you said, again, there needs to be that discussion, one. Two, do not be afraid to go and talk to a specialist, aka Dr. Omanwa, 5th Gong Road pale, 3rd floor, 304, 314.
Yeah.
Number iko pale nimeipin because, and it's actually cheaper to go there.
Yeah.
To manage my challenges versus here, but it is important if you really want, because some women, and I, again, if you guys haven't seen his videos, a woman is, if she's willing to want to have a baby, she'll go at any length.
Oh, yes.
And I remember him doing an interview where there was a lady,
I
it doesn't
don't even want to
matter,
hear that story. That story is just graphic.
but the lady was willing to
do.
want to have a baby. So whatever it took for her to be able to find out if she can,
Yeah.
even the harvesting. And I remember, I think you talked about it. It was even himself, he was cringing narrating the story.
Alisikia uchungu.
Ile mbaya.
Yeah.
Daktari
No, but I think,
can
but,
say it,
but-
but-
Yeah,
but I think bottom line, there needs to be a forum, rather than laying blame.
No,
We don't
absolutely,
blame.
never.
Yeah, there needs to be a forum.
Yes.
where this becomes normal. I think one
The
way,
OneMic show is
wa-
it.
wa-
I'm just
one way,
saying for a
one
friend.
way of normalizing it is having it included in the annual checkups. I don't know who makes decisions on what goes into an annual checkup, but I think this just
Insurance
needs to be
companies.
something standard.
Insurance companies.
Yeah, and
Insurance-
that becomes a problem.
Yeah. Insurance companies, fertility, no.
Yeah, and that becomes
Yeah,
a
they become a
problem. That's
problem.
an issue with the
It's becoming a little bit
with
better
the
where
healthcare
the initial,
system.
But
the
also-
initial, they check you.
But
They
also,
pay for it.
it's important to have a discussion, even in a relationship.
Yes.
If you're
Correct.
meeting
Don't
somebody,
assume each other.
don't assume.
Yes.
Yeah.
It is important because there are people who don't have kids. They don't
Yeah.
want.
Yeah.
There's some people who want to have kids. So it's one of those, nikiingia huko ndani, first I'll be like, I'll convince that one, I don't want kids. But because, the person is so tall,
No,
or the
have-
person is
have
so,
that conversation.
akona haga, sijui akona nini, alafu tunaingia huko, alafu tunakuta vindu vichenjanga. But it is important.
Yeah.
I'm telling you. And this is a topic for another day.
Yeah.
But it is important to have that conversation heart to heart with your partner.
And I think also the media. I was talking to Doctor before the show. One thing that we noticed is that even the media houses, most of the media houses, and I know this is not in your control, Doctor, most of the media houses you went to, they were providing female journalists to cover these topics. I mean, I know there might have been men.
There was one.
There was one.
Just
but
one show.
Most of them.
Everything else,
Most of them we had women, and that's why we decided when this opportunity came, we decided to take it upon ourselves that we
And
are
we
gonna
want
I
to
have
even
thank-
decided
this
not to ask them
conversation.
any questions. I would ask you as a doctor. I was
Yeah.
like, let them take the nini.
no, because
That's
what we wanted,
passions.
what we wanted to do was we wanted to bring to the forefront that men themselves even do have a problem. You cannot defer the blame to the women, because everywhere we go, we always hear, mwanamke, this, haizi kapata mimba. And kumbe, again, it's the jamaa.
Yeah.
But even given the opportunity, even an opportunity is presented, you've got the money to want to go and get tested or to find out, can your soldiers' career, are they Omanyala or are they Kipchoge ama wanadose too ama they're just chilling, you're just running circles? You don't, you know, we don't. But it is a very important conversation, especially for guys. If you want, find out you yourself personally. Kama wewe mwenyewe. And actually, and I don't think he mentioned this, but you know, if your joints don't descend into the cup, surgery has to be done, because those ones can probably give you cancer.
Yeah.
But that is earlier. But later on, once we discover in adulthood that they did not descend, then most of the time they're removed.
They're removed. No, unatoa. So I think it is a conversation, jamas, dudes, guys.
Call to action.
Don't wacheni kuangalia madem. First and foremost, look in the mirror. Are you the problem? If you think you are not, make sure that you can certify and justify that you're not.
Now,
enda ona pale Dr. Omanwa.
Yeah.
Alafu mfanye test, because you know his videos are amazing.
Very.
The content is so rich, and again, like you said, it's not that it's who or whatever, but even possibilities of not being able. He gives both the women and the men's side, but just enda muone.
Yeah. And I know there are so many comments.
So many comments.
There are so many questions.
Some of them.
There are so many questions.
I'm just reading the comments.
Okay, read the comments, then we'll wrap
Okay,
up.
just read the comments and
Mi
we'll
niko
wrap
na
up.
swali
Yeah.
moja mukifika hapo.
Yeah.
So yeah, go ahead and read the comments.
Okay. I'm just gonna go read all of them. Sex education is a must. Religion is the elephant in the room when it comes to this topic. Daktari, please. Okay, never mind. Sexual education should be as early as preschool. We start by teaching them about agency over their bodies and being on the lookout for predators. Slay says, Slay says, I always tell my daughter, no one is allowed to touch you. No one. I found myself in the doctor's office with Stephen, in my doctor's office with my daughter, and decided the sex talk for me. And I was like, Allah times 3. They made it easy for me. It felt a bit easier, and my daughter and I were not uncomfortable. I guess I was a lucky man. Elolata, very true here. In the West, the kids are taught which body part you don't allow anyone to touch, and if anyone does, you report. Hysterectomy ni mwisho. Elolata, we don't talk about it because we have concluded sexual education is about sex, is about having sex, when it is much more than that. 100% true. Goshiani, sperms are just like whatever that is. Oh, this never mind. We used to be told you sit on a chair that a guy was sitting on immediately after the guy left, you would get pregnant. You know, stigma.
Myths.
I know stigma and traumas in this topic in our society is what needs to be fired upon. The heart-to-heart conversations regarding your sexual productivity with your significant other can be challenging. I don't know why you're married to that person, by the way. But anyway, can the doctor come back next week? Are they marching in the army, calling them soldiers? Thank you, OneMic Show, for highlighting this very important topic. Culture is our biggest setback here. Guys in Kenya will not check.
By the way, guys, listen. Doctor's information, we've pinned it. If you want it, we'll give you. If you're into 54 and you know somebody, 5th Avenue, offices, Gong Road, 3rd floor, room 314. Kireki Omanwa at gmail.com.
Yeah, and we'll give the Daktari an opportunity to give his other details of people want to call him or email
whatever number.
Let's get to a more question and then we wrap up.
Whatever it is, because this we can have like 2 weeks of this conversation.
So Daktari, mine is a very simple one. Can you, in a summary, explain how what PCOS is and how it would affect the whole infertility chain?
Okay. PCOS, as the name says, is polycystic ovarian syndrome. Actually, it's a misnomer in itself when you say it ovarian, polycystic ovaries, meaning there are many cysts on the ovaries. But when you talk about a cyst is basically a collection, a structure which has either fluid or some other substance in it. So when you talk about ovarian cyst, you have what you call simple cyst, which has clear fluid in it. You can have what is called a hemorrhagic cyst, which has fluid and blood in it. You can have an endometrial cyst, which has old blood in it. You can have a teratoma, which has different parts. You may have teeth, you may have fat, you may have hair in that cyst, and so on and so forth. But this is not the type of cyst that we are talking about. Here we are talking about small structures which are about 10 millimeters or less, which are many, and they are arranged in a certain way, in a concentric way. When you do a scan, it looks like a pearl necklace. You know the way the pearls
Yeah,
appear.
the stones are joined, yeah.
Yes. Now, a simple way to actually explain what the problem is, for example, here, how big is this room? About how many meters?
Maybe 20 by
Let's say
10.
about 20. Now, we are 6 of us here. Imagine we are 20 of us here, or even 30 of us here, and then somebody says the fire alarm goes on. What will we want to do? All of us will want to get through that door, isn't it?
If OneMic doesn't crash us first.
Yes. Now, when we
Much
get
to
to
say.
that door, because all of us are agitated, we'll actually all of us get stuck at that door.
Correct.
So we'll remain inside here. So in a simple way, that is what polycystic ovaries basically that sort of graphic presentation. In that, at the time when because a woman produces 1 egg every month, by the time when it gets to that time when she's supposed to produce 1 egg, there are too many of them which want to come out, and none of them comes out. So they are stuck at a certain level. All of them are around that 10 millimeters, and they don't grow further than that. Now, how does this affect fertility? It does affect fertility because that process in itself of releasing 1 egg is actually not complete, or sometimes it takes very long.
Irregular.
Yes, sometimes takes very long, or sometimes it doesn't even happen. I had a patient who has a period once every 2 to 3 years. So if that one wants to get pregnant, it's not possible for her to get pregnant because she does
That's
not know.
normal.
It's absolutely very, 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 very abnormal.
Yeah.
Now, again, it is a syndrome because in a syndrome, you have very many symptoms. And some of these patients, you have a small percentage of these patients who will have actually no symptoms at all. They have regular periods, they get pregnant, they have no issues at all with their hormones and so on. And then you have a small percentage who have actually most of these symptoms. They are overweight, they have issues with irregular periods, they have hair where it is not supposed to be, they have low libido, they have issues with bloating, issues with thinning of the hair, and so on and so forth. And most of them are actually in between here. So polycystic ovarian syndrome is a big problem. As I said, it affects about 10% of the young women who come because of issues of infertility, because most of the time of the irregularity of the periods. The ones that have no symptoms at all and they get pregnant and deliver babies, actually that is discovered coincidentally. They've come with another problem, and when you do a scan, you say, has somebody ever told you you have polycystic ovaries? You say, no, I've never. Do you have regular periods? You say, yes, and so on. So this is the challenge that we have with these ones who have irregular periods, have issues with their hormones, sometimes have issues with, in the future, they usually can have issues with diabetes. They may have issues later on with endometrial cancer, and so on and so forth. So, yes, it is a challenge.
So is a quick treatment for that to do birth control, or is there a surgery?
Now, again, it depends. It depends on what these patients want. If it's a young patient and the issue is irregular periods only, then the treatment is completely different. Most of the time, we can put them on birth control pills, and they have that regular periods that that they long for. If the issue is having a baby, then of course we go down the path of diagnosis, because the polycystic ovary can exist with other issues as well. So we go through the proper diagnosis, proper workup of the patient and also the spouse, and then we come together. Now, just very, very broadly, if the issue is weight, because I say most of these patients are are overweight. A big problem in the Middle East countries, in Oman, in Saudi Arabia, in the Arabic countries. Why? Because the change of diet. These people love sweets, and
Yes.
they love them so much. So very, very big problem. I was actually in a meeting one time, and the consultants who came there, they said, they have 40, 45, sometimes 60% of the patients that they see, they have polycystic ovaries. So when they lose, when you engage them in a program whereby they change their lifestyle, they change what they eat, how they eat it, when they eat it, an exercise program. Sometimes you may throw in some medications, to reduce the body weight. And if they reduce the body weight by about 7 to 10% over a period of about 3 to 6 months, the periods actually become regular. And once the periods become regular, it is a lot easier for them to get pregnant. So if it's a question of infertility, it's a different avenue. It's an issue of regular periods, it's a different avenue. Sometimes in the past, yes, we used to do open surgery and do what is called a wedge resection of the ovaries. And there was really no good explanation why by doing that surgery these women had regular periods and they got pregnant. But the explanation that came out is that you increase the surface area, you increase the area so not so many of these follicles, because a follicle is what carries an egg, not so many of these follicles come out, so they end up having 1 or 2 follicles coming out regularly. Nowadays we don't do that type of surgery. If we have to do surgery, then we do what is called laparoscopic surgery, whereby we put a camera in through the belly button, and then we do drill some holes. The effect is basically similar to what used to be done in the past.
Okay, now for those who have any more questions, they now have to consult doctor. Doctor has worked overtime today. There was a quick question. The diaspora said that my topic was not addressed. I hope it wasn't bluffing. I think it was a question about tracks. And I think you already addressed that question.
I think we talked.
Yeah. I think we already talked about that. And I think you can just go back to the conversation and listen to it. But Daktari, before we let you go, please give us your contacts for anyone who wants to consult, for anyone who needs advice or anything. What's the best way to reach you?
And also don't forget your Facebook page.
Yes.
That you normally handle. You normally have
an assistant.
No questions.
Oh, it's a robot.
It's a Q&A.
Okay.
On his Facebook page, and the title of it.
All right.
Yes. As we heard all throughout, my name is Dr. Kireki Omanwa. I'm a consultant obstetrician and gynecologist and a fertility specialist in Nairobi. My offices are at Ngong Road, and the office building itself is called 5th Avenue Offices, on the 3rd floor, suite 314, 314. The number to the office, my office line, obviously +254, very easy to remember, 780-170-170. 780-170-170. That is to the office. My Gmail address is also very straightforward, kirekiomanwa@gmail.com.
Very easy.
And the Facebook account that I do the question and answer, it's called Kenya Fertility Support Group. Every so often on Sundays, sometimes once a month, I do a question and answer, and you're more than welcome to send your questions there or your comments, and I'm more than happy to deal with them.
Okay.
So,
all right, great.
Do they need to get your M-Pesa number ama hizo ni vitu mtaongea?
M-Pesa sitakuja baadaye boss.
Itakuja
Okay.
baadaye.
No, mtu uliza tu.
Yeah.
I just try to join that group.
Yes.
It's a private group.
It's a private group.
So first question, are you battling infertility?
Yes, we do that on purpose. We've done that on purpose because, unfortunately, we did find people who come in and they start doing their own advertisements.
Okay.
Yeah.
So we decided that we have to vet whoever wants to come in first.
No, that's
So
very good idea.
I agree on the advertisement, but then if somebody is not battling infertility, they just want to know.
Yes.
Is it a yes or no answer?
It's a yes. It's a yes or no.
So if I say no, will I be accepted?
We will look into
You'll
it.
be vetted.
We'll vet it.
Yeah.
We'll vet
I
you.
just say
Because
no.
the other
All
question.
right.
Yeah.
Say you have
Okay.
M-Pesa.
Okay, Daktari, parting
Yes.
shot before we completely wrap this up. Any parting shot, especially Kenyans who are living in the diaspora. Most of the audience here is Kenyans who are living out here in the US.
Yes. I think what I would say to them, especially for the men, because today we are talking about men, we touched about ladies a bit. For the men, I think we need to be courageous. We need to come out. And if you suspect or even think that there could be an issue, you need to come out and have a test done. Visit a specialist. If you are in Nairobi, because there may be challenges here, I know the system here, you have to go to your primary doctor who may have to send you to a specialist, and sometimes the waiting times may be long, it may be also be expensive. Nairobi is a lot cheaper. A sperm test will cost about $40. Consultation is about $40.
Okay.
So with that in mind, you can come and visit family, and at the same time, you can actually have these tests done.
So December utakuwa job. I just want to know for those people asking.
December, unajua December pia
December ni sherehe.
No,
tunapumzika
kuna watu
bwana.
wa summer bunnies. Unajua summer bunnies watakuwa.
Summer bunnies wamekuja huko.
Watakuja consultation, unajua ticket prices.
Na summer bunnies hizi kwa $40.
Ticket prices inaweza kuwa na, you know.
So December till around the 15th I'll be at work, and then after that I'll take some time off.
So
to spend with
wakikuja
my family.
Suneka hawatakupata huko.
Suneka siendagi Suneka, lakini wakija na wakiniletea mandizi kutoka Suneka nitakubali tu, there's no worry.
Find him in Nyamira sitting under tree.
You just had to go there.
Sorry.
Yeah.
Jemo.
Washeke is saying,
Yes.
Doctor, before you leave, can you please encourage men to share the burden of birth control stroke contraceptive?
Yes, that is also important. First of all, we have to demystify the issue of contraception. And one of the things that comes out every other time we talk about contraception is that it leads to infertility. That is not true.
Okay. That's good to know.
Contraception is basically to space those children that you want. So taking contraception will not lead to infertility. I think that has to come out very, very clearly. Now, again, it is important for people also to know, because as I said, anytime we talk about contraception, we want to talk about contraception in our schools to our adolescents, there's a lot of pushback as well. I had a discussion one time with one of my senior colleagues, and what he said on TV was something which I can't put here. There's that notion that contraceptions are not medications, and they are medications because we use them in different issues. For example, in patients who have very heavy, painful periods, we use contraceptive pills, oral contraceptive pills. Patients who have endometriosis, we also use contraceptive pills, and so on. So by using contraception apart from planning the family, there are also other places. For example, you have you just got married, and your honeymoon falls on the time when you're having a period. So we can push that away by using contraception. So it is important that we gentlemen understand and support our women, our partners, our spouses in this area. And it is not a given that oral contraceptive pills are for everybody. No, there are so many other methods of contraception which we discuss with the patient, and the patient chooses and said, I think this is what I think is good for me. And that is the one that we will administer.
What if you've
Ruth, we really need to go.
One second. What if you've decided this is the many kids we want to have?
Yes.
No longer want to have kids?
Yes.
And I know you don't have time.
Yes.
1 minute, vasectomy.
Very, very interesting, because there was an article, I think last week, that more American men, African American men, are actually going for vasectomy because of different issues. And I think it is because of child support. So you have a child with this lady, and another one, and another one, and another one. So when it comes to paying child support, you actually don't have anything, to take to spend on yourself. Now, it's a myth again that gentlemen need to know that the fact that you had a vasectomy done does not mean that you cannot have a sex life. You will have a sex life, only that you will not
have babies.
You not have babies. Failure rate is about 1% or less than 1%. But then the other thing, the flip side as well, is that later on, if you do want to have a baby, you will not have that baby naturally. Then you may have to undergo, your wife has to undergo IVF, and we do what is called surgical sperm retrieval. We get those sperms from where they're supposed to be stored, and we create embryos.
So you can get children.
You can get children through assisted reproduction technologies. Not naturally.
All right. Asante sana daktari. You know,
na wahenga walinena
exactly.
Kilicho na mwanzo hakina budi kuwa na mwisho. Meli imetia nanga. We are about to wrap this puppy up. OmoshFaya Buddha Boska there. Start us off and don't feel ashamed, Omera.
Daktari, asante sana. Thank you for coming through. This has been, I was going to say, mind-boggling. I don't think we had enough time. Maybe we should have had this discussion for 2 days. We should have started on Thursday, or should I say Wednesday, and then we maliza Friday night.
Started Monday.
So Sunday morning or something like that. Because we can go and go on
yes.
and go on. This topic, to me, I think it doesn't end. But we've left here enlightened. And for those guys out there who think there's shame in these subjects of fertility or infertility or lack thereof, don't feel ashamed. The body is a very complex organ, and it goes through certain changes, depends on what's happening around you, financial, emotional, there's so many other things that affect that whole cycle. So going to a fertility specialist is not an issue. It is not a problem. And you may even get to the point where you're the one who may have to go through IVF with your spouse, and wewe ndio mtu wa kufanya zile ma injections. And that in of itself can be psychologically damning. So you need to prep yourself. It's not a problem. It's not an issue. This is part of life. Things happen. This is just, at least we have a medical solution to get you through this process. So, that's the message. My parting shout out to my brother out there. And Daktari, thank you. Please come through again. When you write the book, please make sure you preface it with chapter 1 of OneMic show. And maybe we need to start.
We like that.
Maybe we need to start having a monthly, Dr. Amana's tips for, what uko nje. I don't know.
No, doctor is busy, but we can have a periodical. Maybe quarterly.
So atatuandikia periodical, ama it's gonna be on Zoom.
Something of that sort.
Because I think Julius me wetu wa fertility is, in fact, he's the show's doctor. I see it kwa ubaya.
We've appointed him unofficially.
Ama tumekuwa na daktari mwingine?
No, I don't.
Now he knows. Well, kuna daktari wa computer science. Alafu kuna daktari wa biology.
He's an MD. He's the only MD
biology
on the show. So he's our, for lack of a better word, our Dr. Oz.
Why?
Why Dr. Oz?
No, not political.
Why Dr. Oz?
Because that's where he started. You guys know what I'm talking about.
Okay, sir.
So make sure you hug your loved one. Tell them you love them. Maisha wa short. Trust me, my peoples. And with that said, next week tutakuwa wapi? Hapa. I'll see you.
Yes.
Back to you, studio.
All right. Ruth.
Today has been very educative. I'm glad we were able to have the doctor in studio and to ask questions. If you have any extra questions, definitely reach out to him for second opinions or whatever you might have. And I'm glad we were able to provide this show. And we discussed so many things that are important, not only infertility or fertility issues, but also things to do with, it's very common to women of African descent, fibroids. We talked about HPV. Please, people, get your vaccines if you haven't. And thank you. And thank you for the audience for being part of it and participating. We really did appreciate your questions, your comments. And next week, we'll be here. Thank you.
Will you be here next week?
Unfortunately, no.
Okay, we're just checking, just confirming.
Huyo anaweza kuacha Kenya. Hebu cheki hiyo.
I'm taking a break from the show until next year.
Okay, all right. She's taking an early break. So Pablo kuja hapa kutusumbua. I've not seen Pablo today.
He was here today.
Yeah.
So Pablo,
He didn't know that Ruth was
Pablo Kwende.
Yeah,
He
I don't
didn't
know.
know.
Yeah. So
Asena Pablo.
yeah. So anyway, Daktari, asante sana.
Karibu sana.
You know, like this is, I have to say, this is one of the most challenging show I had to prepare. You know, like I personally have interviewed so many people. I think I've interviewed over 500 people since I started doing the OneMic show. But this was a very challenging interview in the sense that, you know, like when this opportunity came up, I felt very illiterate on the subject. You know, so I had to start consuming a lot of content. I had to start consuming a lot of interviews. You know, like you've been in my living room. You've been at work with me for the past like 2 weeks. You know, you know, as I've been trying to put this together. Yes, and exactly, yeah, because we had to present this in a way. You know, the other very challenging thing about journalism is you, as the people who are presenting the show, you're the ones who understand your audience. So you have to make sure that this will be served in a way that the audience understands.
Absolutely.
Because the doctor has studied so much, he speaks to so many different audiences. So it's up to us, you know, like to slow him down if we feel like he's getting a bit too technical. Which actually we didn't have to do a lot of. We didn't have to do that much, which was very good. There was a lot of understanding. And the other thing is that this is the longest interview that we've done.
Yeah.
Our interviews are typically an hour and that's it. You know, and then we go to other aspects of the show. But this being a very important topic, we just had to let it flow and make people understand and make this the beginning of getting people, especially men. Women already talk about this, especially men, to understand that there is nothing wrong.
Absolutely.
If you feel like there's something wrong, it's okay. And I'm hoping, you know, for the men who've been listening to us, wamekata kupiga simu, wengine wamekata kucomment, but I think at the very least, you'll be able to reflect back, interrogate, and go have a conversation with your spouse, with your girlfriend, or with your partner, and just discuss if there's a problem, which I think is the biggest step.
Even just as an individual.
Yes, which is the biggest step towards a solution. And to other guys, I know guys, we like banter na nini. Let's also be sensitive. If another guy brings up this topic, you know, like let's try to be sensitive, because guys, there's a tendency whenever they feel maybe belittled or attacked, they have a tendency of pulling back, and maybe that solution will never come up.
Absolutely.
Yes, na yoyote ambaye anataka kunipigia simu, nambari yangu bado ni ile ile 1-800 mteule, na operator akishika simu, mkumbushe unataka kusema na mjukuu, na akikuuliza ni mjukuu yupi, mkumbushe ni mjukuu yule yule wa Masai, because I'm Kenyan by blood, American by design, Masai by choice. Sichagui, sikagui, na sibagui. Kwaherini.
Aiden, Daddy loves you. Njeri, Daddy loves you. Nimo, Daddy loves you. Until next week, be blessed.
Wow, that's almost...
Anuwood kamwana Okwankwo Koreka donjo Kamimiele Fumo donjo dalawa Shere watueyo Ongelengo I'm not available tonight I'm playing my cards right I'm not losing Wechegi wekete chuni Oyeyo makai Makudi Kikituona kea